Hi, I'm Stacy Beeler, board chair here at the YMCA of Greater Grand Rapids and group vice president of today's sponsor, Meijer. Please join me in welcoming our keynote speaker, Tina Friestecker, president and CEO of Spectrum Health and a board member with me here at the YMCA.
I am honored for this opportunity to speak to you, since for my entire life, I have been a big fan of the YMCA. My admiration for the Y goes all the way back to when I was in the father-daughter program, which is now Adventure Guides. This created wonderful lasting memories for me and my father as we went camping, horseback riding, and did art projects together that used every plaster of Paris mold they had. I have served on the David D. Hunting branch board and have been on the Y's Association board since 2015. Currently serving as the Strategic Planning Chair. And like so many others, my family enjoys all the benefits of Y membership. But despite this lifelong involvement with the Y, my respect for the Y has never been greater than it is now. It's hard enough to be a nonprofit that serves the community during normal times. It's that much harder to do it during a pandemic, and to be reinventing yourself in the process. Yet this is what the Y of Greater Grand Rapids has done. When COVID-19 came to Michigan, the Y could have understandably chosen to simply shut down. After all, here in Grand Rapids and in 10,000 neighborhoods across America, the Y is known for its community centers, and all of them had to be closed. But our Y didn't take the easy path. Instead, they remembered their purpose, which really isn't only providing swim classes, gym facilities, and youth sports. These are invaluable services, but the Y's purpose is so much bigger. It is to strengthen community by connecting all people to their potential, purpose, and each other. It is to strengthen the spirit, mind, and body of all individuals. With this in mind, the Y pivoted to meeting urgent community needs as they led with humanity and heart in providing food distribution and childcare for families with nowhere else to turn. In addition, for the health and well-being of the larger community, they offered free online fitness classes and family-child engagement activities through their website. Again and again, they responded, adapted, and innovated. They provided education, they provided connection, and they provided leadership. Their services are essential and their impact is widespread. Instead of focusing on what they couldn't do, the Y focused on what they could do. In this way, the Y actually became more important to this community when we needed them most. But the fact is that this sort of reinvention is in the YMCA's DNA. Those letters actually stand for the Young Men's Christian Association. But to millions of people, YMCA stands for much, much more. I think it's worth reflecting on how it all began back in 1844 in London, when that city was a harsh place for young men. The YMCA was created to offer a refuge of Bible study and prayer. In 1851, this concept jumped across the Atlantic Ocean to Boston, and in 1866, it came to Grand Rapids when a small group of young men formed the first local YMCA. Since then, the Y has evolved and expanded tremendously, but it has remained true to its core, providing a refuge young people and their parents and grandparents can turn to for support, understanding, inspiration, and community. Because the Y is so important to this community, and because it has stepped up so impressively in addressing the challenges of this pandemic, I believe it will be playing an important role in taking us not to a new normal, but to a better normal. Yes, I believe that once we are on the other side of this pandemic, we will discover that our community is stronger, more cohesive, and more appreciative than it was before. But needless to say, we are not there yet. We are in a marathon. We don't know how long it will be. We remember the starting line, but the finish line is still unknown. We are fatigued, but like long-distance runners, we keep going. This isn't easy, especially with winter approaching and COVID-19 cases on the rise. So I'd like to share some thoughts about how we get from here to the better normal that lies ahead. First, it starts with each of us. We have more power than we may think. We can protect ourselves from the virus by taking steps like wearing a mask and doing what we're doing right now, gathering virtually rather than in a crowd. As I said, this is a marathon, and like any marathon, pacing is key. This is why it is so important to take some time each day to restore, rejuvenate, and refuel. At the beginning of the pandemic, I was guilty of not doing this. So many things were happening, and there were so many unknowns, so many decisions to be made, that I felt I was going from one crisis to another. If I had kept that pace up, I couldn't have kept running the marathon. I realized that taking a few minutes of quiet time is not wasted time, any more than it's a waste of time to stop at a gas station to fill up your tank. Finding time for ourselves is essential to avoid becoming depleted. So each day, I find a little time, sometimes only 2 minutes, sometimes 10 minutes, to just sit and reflect on what I am grateful for. I let my mind go blank to help center me, help me focus on what only I can do, and then I act. I am much more refreshed and able to do what others need me to do, what my organization and our community needs me to do, and what my family needs. I truly believe that those few minutes of centering pay off with a multiplier of added productivity. This is why I urge you to take time for you, even if it's just 20 seconds. Centering yourself in a moment of solitude on what is most important matters and helps you do what you do well. At Spectrum Health, we are increasingly focused on mental health in our community. During these challenging days, make sure to focus on your own. Mental health and physical health go hand in hand. Take care of yourself physically, eat well, put on those extra clothing layers, and go for a walk. Or just take time to stretch, or go to the Y. And be willing to ask for help. None of us is an island. We need each other even more today. Though asking for help can be difficult, when someone does reach out to us, almost all of us respond enthusiastically, supportively, and with an empathic yes. In the early days of the pandemic, many of our providers at Spectrum Health needed help with childcare. Some of our doctors and nurses and other care team members were left facing an impossible choice: show up for work and leave their children unsupervised at home, or stay home with their kids and leave our patients and communities without needed medical care during a global pandemic. When we reached out for help with childcare, the Y responded with an enthusiastic yes and provided emergency childcare services to 140 families from 3 area hospitals, including ours. We are so grateful. Second, we need to hold on to our values. To put it simply, values are valuable. They anchor us and guide us, especially in difficult times. The YMCA's values are caring, honesty, respect, responsibility, and inclusion. These values have underpinned the success of the Y as an organization, and they certainly can be beacons of behavior for each of us as individuals. That first value, caring, is especially important as we continue to contend with COVID-19. Even though we are physically separated from each other, we can reach out virtually to loved ones and close friends to show them we care. People want to know they are appreciated, understood, and valued. Simply taking a few minutes to check in on someone can lift their spirits for days, and it can lift our own. At Spectrum Health, we try to make caring a centerpiece for who we are, especially during the pandemic. For example, at our Renewed Hospitality House, we create a way for people to say goodbye in person to loved ones at end of life. One of the great tragedies of COVID-19 is that so many people have had to die alone. This is heartbreaking for them and for their family and friends. And to whatever extent possible, we are determined to not let this happen. The Y demonstrated a similar commitment to caring and compassion by proactively checking in on seniors and individuals at greater risk of COVID-19 and of social isolation. Rather than assuming that people experiencing loneliness would call or send an email, the Y called them. They called members like Martha, who admitted her exercise routine fell by the wayside during the pandemic, and requested another phone call to help keep her on track. They called members like Ernie, who reported he wasn't doing well with all of the facility closures and felt worried about others whose health might be negatively impacted by not staying active. The Y assumed the responsibility of maintaining those social connections, and in so doing, they lived up to two more of their organizational values: responsibility and inclusion. And if I may, I'd like to add one more value to the list, and that is courage. The Y has exemplified courage this year, and so have many of you. It has required courage to face the many unknowns of this pandemic. It takes courage to face the dark days that still lie ahead. And it will take courage to create the better normal that we will all build together. In the early months of COVID-19, we had to draw on courage at Spectrum Health in many ways you would expect, as our caregivers had to do their jobs without fully knowing the risk to themselves or their families. Today, we are also drawing on courage as we experience increases in COVID-19 hospitalizations, which put significant strain on staffing and bed capacity. The Y showed courage as well by carrying on in the face of seemingly insurmountable obstacles. The Y was not eligible for any of the federal funding programs many other businesses had access to this year. So they not only had to innovate with their programs to be safe, but also to be financially responsible. Again, the Y could have stopped all programs and services, but they knew the importance of camp and the value of kids playing and being around others in a safe, socially distant way. Their dedication to finding a way to provide those experiences helped kids like Jaden. Jaden was born addicted to drugs, was put in foster care at 4 days old, suffered abuse while in foster care, and was placed with a new family at 18 months. In his 5 years, he has worked really hard to overcome these early traumas. This year was Jaden's first year going to any type of camp, and the Y team left a lasting impression on him. At least once a week, he asks when he can go back again. Amid a chaotic time, when many camps were not able to operate, the Y opened their camps. They provided kids like Jaden a safe and supportive place to be, a place where kids from all backgrounds and experiences thrive. These programs also helped parents and kids, like the one who said, "Thank you for being there for my kiddo this summer. She was a shell of herself from being home from March to June. And with the Y as a safe space to be, she became her fun, funny, sweet self again. Caring and courage are two of the values that I cherish, and they give me strength. But whatever your values, hold them and let them hold you. Third, we should set our goals big and bold. In many ways, the pandemic has made the scale of our lives small. We are home, we can't have large gatherings, we don't travel, and we feel isolated. But this is all the more reason to think big about what we want to achieve for ourselves, our families, our businesses, and our community. At Spectrum Health, we are driven by a bold vision, which we adopted in the last 2 years. Personalized health made simple, affordable, and exceptional. One example of how we are moving toward this ambitious goal is telehealth. We began our telehealth journey 6 years ago because we believed that we had come to a moment in time when people with health needs could be seen anywhere from anywhere via technology. But as with all big ideas, not everyone agreed. We faced many challenges, including payment, regulatory rules, technology, and physician and patient acceptance. We worked through all those issues, created a platform, and built it steadily. By the time the COVID-19 pandemic hit, we were well ahead of the industry with 31 specialties participating. Overnight, when the pandemic hit, we trained over 1,600 providers in telehealth. In the first 10 months of 2020, we have conducted over 142,000 telemedicine visits. And to give you some context for this, in all of 2019, we had 20,000 visits. So this year, we've seen a 700% increase. The Y has made similar bold moves. A few years ago, when we developed the Y strategic plan, we decided to focus on youth. Just as with telehealth, this idea faced resistance. There were advocates for different groups of all ages. But the Y's strength and differentiation has always been in that first letter, Y, for youth. We needed to ensure the young people of our community could continue to grow, develop, and prosper. This bold vision is needed now more than ever to drive this organization forward. In addition to taking care of ourselves, holding on to our values, and being bold, I believe there is one other attribute that can help carry us through these difficult days, and that is trust. Trust in ourselves, trust in each other, and trust in our collective ability to take this community to the better normal that lies ahead. At Spectrum Health, we are humbled by the trust our community places in us. A trust that we will be there for them in a time of great need. A trust that we will be a source of help and guidance. A trust that we will stand together in tackling the many challenges we face with commitment and hope. This trust is our great responsibility. The Y enjoys the same sort of trust. This is why it was so successful in transforming itself earlier this year. People trusted the Y to come through, and it did. And today, the Y's bond of trust with this community is greater than ever, and needed now more than ever. This is why I ask you to financially support the Y, thus helping the Y continue to serve our community. Our Y is a community treasure that deserves our support. They are making a difference and providing needed services that make West Michigan a safer and healthier place for all. By making a gift to the YMCA during this year's Hour of Impact, you will help bring the same strong response to community needs that we've seen from the Y this year into 2021 and strengthen the impact they make in our community. It is thanks to organizations like the YMCA of Greater Grand Rapids that our community becomes more connected. and supported in times like these. I believe this connectiveness will help lead us to that better normal that lies ahead. For Spectrum Health, for the YMCA, and all those of us who support and rely on these organizations. The marathon continues. And as we keep putting one foot in front of the other, caring for ourselves, strengthened by our values, and boldly looking to the future, I am confident we are going to make it to that finish line and well beyond.